Hi, I'm Gary White for Central Kentucky Television. I'm here with Dr. Johnny Isaacs with Isaacs & Isaacs General Dentistry, right on Bobolink Drive in Springfield, for our update on all things dental. And October is actually Dental Hygiene Awareness Month. So that's something important, right?
Gary, I'm glad you keep up with all this stuff. You know what every month is about. Last time, I think we did some kind of dental month, but this is Dental Hygiene Month. Yes,
that's right.
Yeah.
So what's the difference? Hygiene is just making sure that everything's good, right?
Yes, hygiene is more of a routine maintenance. Hygiene, of course, keeping things clean, and that's what we're going to talk about today. Is how we keep our mouths clean and what we use to do that.
Now, we've talked in the past about brushing, and you've told us how to brush and how often that you need to brush. But when you go to the store to pick out a brush, you have many different options. And it's particularly with the bristles that are the big options, right? So we have soft, medium, hard bristles.
Basically, yeah, you have those soft and hard, and sometimes it's hard to find the hard bristles, which is good because we don't recommend the hard anymore. We recommend soft. Now, when I was a kid, 40 years ago, back in the 70s, I can remember dentists recommended hard toothbrushes. My dad's a dentist, retired. But I can remember him recommending hard toothbrushes. And what happens over time, if you use a hard toothbrush, you'll actually wear the gingiva, which is the gum tissue, and the tooth surface down. You can wear it down. People are keeping their teeth longer, way up into old age, and you can keep them forever if you maintain it. So they were seeing a lot of elderly people with a lot of we call it toothbrush abrasion, and it does wear it in there. And there have been some lawsuits. There was a lawsuit against a toothbrush manufacturer because there wasn't a warning that if you use this toothbrush you can damage your teeth. And I don't know how it turned out. I hope it was thrown out, but I remember seeing that years ago that there was a lawsuit about it. Oddly enough, the man who sued, his son was a dentist. So it looks like to me they were trying to get it out, had it out for the toothbrush company. So I don't know how that worked out. So, but we do recommend using a soft bristled nylon brush. Which is about all you can get now is nylon. Back years ago, they had other stuff. Of course, they used to use horsehair. So they don't use horsehair anymore. It's now nylon.
And how often do you think you should change your toothbrush?
Studies have shown about once a month. And once a month. What happens? The bristles, they should be parallel to the surface of the handle. They start to kind of flare out in that thing. Once it gets to a certain angle, it becomes inefficient. So that's what you want to avoid. You just won't do an adequate job. Now, I brush my teeth quite a bit, and I flare mine out. I change my brush at least once a month, but I do notice the thing is ineffective after a while because it's a nervous habit of mine, and I tend to do it. But you want to use the soft one, throw it out after a month. Don't share toothbrushes. I know it sounds kind of gross, but people actually do it. I'm not going to recommend things, but there's other ways of doing it. So don't share. You can transmit the common cold. It can be transmitted like that. Most diseases can't. There are some other bacteria that can be transmitted, but the brushing, if you do it properly, you are decreasing the number of bacteria in your mouth, and that's what we want to do.
Right. So for everybody, it's soft toothbrush is recommended.
Soft toothbrush, and we have soft here, and we do keep a few medium just because we want people, if they say they're not going to do it with a soft one and they want it something a little firmer, then we do have medium here. But it really depends on the age and how aggressively they are brushing. Some people, if they're a little bit older and they don't have any wear sets on their teeth, yeah, that's fine. They can use about anything they want because they haven't done any damage to it. But if you're 20 years old and you don't have any wear, use your soft toothbrush and get used to that. Okay.
Now we talk when you do brush. They say about brushing your gums. Should you be doing that?
Yes. Yeah. We probably should even say brush your gums instead of brush your teeth. The teeth can kind of almost be maintained without a whole lot of brushing. You can do it with a washcloth and get a lot of the bacteria off your teeth. But the gums, even if the gums are healthy, there's about a 2 millimeter sulcus, which is a 2 millimeter crevice between the gum, the gingiva, which is the gum, and the tooth. So you can't really do it unless you brush your gums, and you want to put that at about a 45-degree angle against the tooth surface, so the bristles will get underneath the gum line, and that is important. Now, when I said 2 millimeters, that's if they're healthy. Now, anything over 2 millimeters is not healthy. So we have people routinely that come in and they have 5, 6, 7 millimeters. So it's impossible for them to clean it. That's why they need a professional cleaning every 6 months, sometimes even more than that.
Now, how about your tongue? Should you be brushing your tongue?
Should brush your tongue. Every time you brush your teeth, you should brush your tongue too. A copious amount of bacteria adheres to the tongue. The tongue surface is corrugated, and it's got a lot of places where the bacteria can adhere. And there's certain conditions of the tongue that people have. A lot of smokers, the papilla on the surface of the tongue will overgrow, and you'll get bacteria growing inside of that. So certainly get in there and scrub the tongue too. Even I tell people, it makes me choke. That's okay. You'll get used to it, or if it makes you choke, just don't go back that far. But you can get in there and do it.
Now, every time you brush, should you be using toothpaste?
Yes, you should, unless certain other if you have other problems where you have a lot of gum disease. I'll tell people to quit using your toothpaste and just use water, because you'll actually do it longer. A lot of times we will quit brushing our teeth when it burns a little bit, and it kind of tells us subconsciously, it tells us, hey, it's time to quit. And if it starts foaming, you got foam going on everywhere, then you tend to quit. So I tell people, if you've got a lot of gum disease, just do it with water. At least you're getting the toothbrush to remove the bacteria from that, and you'll do it longer. Now, speaking of toothpaste, there are two basic kinds. We got paste and gels, and there's really no difference. They used to think that the gels were not as abrasive, but now they're putting silica in the gels, so they are as abrasive, if not more, than the paste. So that doesn't really matter. You want to make sure that it does have fluoride in it. Almost all of them do. Up until the early 70s, Crest had a patent on fluoride in the toothpaste, so they were the only ones that had it. So they had to market. So after that patent ran out, then everybody's got it in there, almost. You have to look for it to find toothpaste that doesn't have it. And why would you not want it? If you're having too much fluoride. There are certain areas of the country that has too much fluoride, so you don't need it. Years ago, they were putting we still put fluoride in the water, 1 part per million, which is not a whole lot, but it's enough to keep the caries incidence down. If you have more than that, upwards to about 10 parts per million, I believe that's where you start getting a corrosive effect on the enamel itself. So if you have that, you certainly don't want to add to it. Or if your teeth are blotched, we call that fluorosis, dental fluorosis. Here in this community, when I first came back here 28 years ago, I noticed a lot of kids were having blotched enamel. It just had these little specks on it, look, kind of polka dot. So I called the schools and had them to quit the swish and spit program up here. And I did notice a market change whenever we did that.
Okay. So again, to recap, it's National Dental Hygiene Awareness Month. That means take care of your teeth and your hygiene. Make sure you're keeping track of what's going in and out of your mouth there. So with your toothbrush, it should be a soft toothbrush.
Soft toothbrush.
And whether it's toothpaste or tooth gel, doesn't
really matter. Make sure that it has fluoride. Almost all of them do. And let me just say, there's several different toothpastes. You can get one that's some of the whitening toothpaste. They advertise the heck out of those. They really don't whiten your teeth. What they are, they means they have more abrasive in it. So they're kind of tricking you a little bit. They're not going to make them whiter unless you have a lot of extrinsic stain, which is a stain on the outside. If you have an internal staining, it won't do a thing for you. So really, it probably doesn't do what you think it's going to do. Some of them have tartar control. Tartar control will work if you don't have any tartar on your teeth. After you get your teeth cleaned, then you can start using that. But it won't do anything with the tartar that's already formed. It won't get rid of your tartar.
Right. Just prevent more.
And it doesn't do anything with the tartar below the gum line. It has to be above the gum line for that to work too.
Okay. So. And when you are brushing your teeth, you should be brushing your gums and your tongue as well.
Yeah. Teeth, gums, and tongue, all three.
Great. And if you have any more questions, you can contact Dr. Johnny Isaacs here at Isaacs & Isaacs General Dentistry. right in Springfield. What's the phone number here?
859-336-7680. 336-7680.
Give them a call, get an appointment, come on in. This has been Gary White for Central Kentucky Television.